Hi everyone! I hope you're all doing well and are safe. Welcome back to the next episode of Cancer Behind the Scenes as presented by Cancer Together. In today's video, we'll be learning about targeted therapy. Here's just a short reminder. Make sure to check the official Cancer Together website for any updated information on this series, to watch our YouTube videos when they drop, and to play the educational Kahoot games to help retain the information in a fun, interactive way. Before we get into any new content, let's just revisit the previous video and recap briefly. So before, as we've mentioned, we've been talking about each form of treatment in their own exclusive videos, and in our last one, we talked all about chemotherapy from topics like what chemo actually does and what determines if a cancer patient will receive chemo, to different types falling underneath this treatment category, how often one receives this treatment, and different side effects. And now, we'll be moving on to our next treatment of discussion, targeted therapy. So let's first talk a bit generally about what targeted therapy is, starting from what it's meant to do. Instead of just killing cancer like some other treatments do, targeted therapy works on a cellular level to stop cancer cells from growing and dividing, and it prevents these cancer cells from metastasizing by zeroing in on some of the changes that differentiate cancer cells from normal cells. Specifically, it uses drugs or other substances to precisely identify and then attack certain cancer cells. And the neat thing is, because this treatment is designed to target cancer cells specifically, based on criteria set, these drugs have a prominent effect on cancer cells and leave most healthy normal cells alone. So you might be wondering, what exactly qualifies as a target to attack for this type of treatment? The target itself can depend on a number of different things, like a cancer cell that has way too much of a protein that shouldn't even be on a normal cell, or one that's mutated, or a normal cell that's found to have certain genetic changes. And of course, tying into this, targeted therapy, as vast as it is, has different types and categories underlying it. These general categories underlying targeted therapy are two called small molecule drugs and large molecule drugs. From the names themselves, you might already have a slight idea of what exactly distinguishes the two of them. Small molecule drugs, like the name suggests, are treatment drugs that are small enough to enter into the cancer cell, and they work by targeting specific substances found within the cancer cells and blocking them. Meanwhile, large molecule drugs usually cannot fit into cancer cells, so they attack weakened or destroyed proteins on the surface of the cell. Oftentimes, these large molecule drugs are described as a lock and key, and that's because it acts like a key opening up the protein on the surface like a lock, and when it does, it allows for the treatment drug to start working. Alright, so now that we've spoken about the general two categories of targeted therapy drugs, let's dive into some specific types. Here are the four we'll be talking about: angiogenesis inhibitors, proteasome inhibitors, signal transduction inhibitors, and monoclonal antibodies. Angiogenesis inhibitors are straightforward in their purpose in that they block the formation of new blood vessels that give nourishment to cancer cells in order to prevent cancer cells from taking more nutrients and supplies from healthy cells and to stop cancer cells from growing more. Proteasome inhibitors work by disrupting normal cell functions of cancer cells so that they die, while signal transduction inhibitors disrupt cancer cell signals, cellular signals specifically, to change how the cancer cell acts. Last but not least, monoclonal antibodies work by delivering molecules with drugs into or onto the cancer cells, and by doing so, it marks it to be better seen, directly stops it from growing, or even and hopefully triggers the cancer cell to self-destruct. So now that we've talked a bit more in depth about targeted therapy, and as we get closer to wrapping up today's video, let's talk about some more general topics like safety and side effects. Some of the most common methods through which targeted therapy is administered are actually the same as chemo, so an IV, meaning through a vein, orally, via your mouth, topically, so applied directly on the skin, or even intravesical, meaning via the bladder. And an important note to make here is that targeted therapy can depend greatly from one person to another with the symptoms that they have. One person could have very few, and another could have more serious problems, of which could be photosensitivity, dry skin, rashes, itching, sore cuticles, and many more. And because many of these treatment drugs are given with others that can be hazardous if they're not handled correctly, cancer care specialists will take the precautions as needed to not only protect themselves, but others and the patients from excessive exposure. And doctors will talk through targeted therapy with patients for whom this can be a better form of treatment. And that brings us to an end for our spotlight on targeted therapy. Thank you for joining us today for this video, and I hope it was informational and interesting for you all. Remember to play our educational games to review the information in an interactive way, and to keep an eye out for when the next video drops. Thank you all again, and have a nice day.